Let's talk about something that's at the very heart of all healthcare. It's this invisible contract, this promise that exists in every single hospital, clinic, and care home. It's called the duty of care. It's the fundamental promise to keep patients safe. But what happens when that promise isn't just bent, but completely shattered by an entire system? Well, the consequences can be absolutely devastating.
This sounds like something from a nightmare, right? But it's not. This is a real quote from a public inquiry into a hospital trust in the UK, where hundreds of patients died needlessly. It's a snapshot of a place where the most basic, humane aspects of care were just gone. Patients left in their own filth, ignored, scared. This, right here, is what a total failure of the duty of care actually looks like.
So you have to ask yourself, how on earth does this happen? It's tempting to just blame a few bad individuals. But what the inquiry uncovered was something way more chilling. The whole system had rotted from the inside out. The real question wasn't just what happened, but why it was ever allowed to get this bad.
And here's the why. The inquiry laid out this grim reality. It wasn't just that people stopped caring, it was a severe, chronic shortage of staff. Nurses and doctors were stretched so thin it was impossible to do their jobs properly. And what's worse, when they tried to raise the alarm, when they tried to say, hey, this is unsafe, they were either ignored or, unbelievably, bullied into silence. This was never a failure of a few individuals. It was a failure of leadership, of resources, and of the entire culture.
When you see a breakdown this complete, it just shatters the very foundation of what safe healthcare is supposed to be. It makes you step back and ask, what is that one core principle that was so completely and utterly abandoned here?
Well, that principle is the duty of care. It's a term we hear a lot, but its meaning is really specific, and it's legally binding. You can think of it as the ultimate safeguard, the one thing that's supposed to prevent a disaster like Mid-Staffordshire from ever happening.
Okay, so what does it actually mean? The duty of care is both a professional and a legal obligation to meet a standard of reasonable care. Now, this isn't about being perfect or being the top surgeon in the world. It's about providing the level of care that any other competent professional would in that same situation. It's the absolute baseline, the fundamental benchmark for safe practice.
Now, here's where it gets really interesting, and this is so important to understand. This duty isn't a one-way street. Of course, the professional, the doctor or nurse, has a duty to their patient. But look at the other side of this table. The employer, the hospital, has a huge duty to its staff. They have to provide enough skilled people, a safe place to work, and equipment that actually works. They're the ones who create the environment that makes good care either possible or impossible.
And that right there sets up the central conflict. What happens when what the employer demands, things like cutting costs or hitting unrealistic targets, forces a professional into a corner where they simply can't meet their duty of care to the patient anymore?
Just imagine that for a second. You're a nurse, you've got twice the number of patients you can safely handle. You know in your gut that the risk of a mistake, of someone getting hurt, is sky high, but your manager just tells you to get on with it. Suddenly, your duty to your patient is in a head-on collision with an order from your boss. What on earth do you do?
This was the nightmare reality for the staff at Mid-Staffs. This anonymous letter from a group of nurses just says it all. Unmanageable workloads, compromised, bullied, and disempowered. They knew things were wrong. They felt that professional pull, that obligation to speak up. But the very system they were working in was actively crushing their ability to do so.
And this isn't some rare one-off thing. These are the classic red flags you see time and again. Workloads that are just impossibly heavy. Not enough people on the floor to keep patients safe. Asking junior staff to do things they aren't trained for. Using equipment that's old or faulty. And maybe the most dangerous one of all, that unspoken pressure to just look the other way and keep your mouth shut.
So if you're a healthcare worker stuck in that terrible situation, what can you actually do? It can feel completely hopeless, but there is a clear, professional way forward. There's a toolkit for taking action.
Here is the crucial part. Speaking up isn't just a brave choice, it's a contractual duty. The official handbook is crystal clear. Staff have a right and a duty to raise these concerns. This isn't about being a troublemaker, it's about fulfilling a core professional responsibility.
And this checklist really breaks down how to do it. First, be specific and gather your evidence. Next, and this is so important, put it in writing. Create a paper trail with an email or a formal report. Know your employer's own rules for this stuff. And be clear not just about the problem, but about what you think needs to change. And finally, get support. Talk to a union or a professional group.
because honestly, this is not an easy road to walk alone.
But when you zoom out, the ultimate goal isn't just about having a good process for sounding the alarm. The real goal is to build a healthcare system where sounding the alarm becomes unnecessary in the first place. It's about building a true culture of safety from the ground up.
And this table shows the two paths an organization can take perfectly. On one side, you have that toxic culture of fear, like at midstaffs, where mistakes lead to punishment and speaking up is seen as a threat. But on the other side, you have a just culture. This is where staff are treated fairly, where reporting is encouraged, and where every concern is seen for what it truly is, a chance to learn and to get better. For everyone. That is the fundamental shift that needs to happen.
Which leaves us with one final, really important question. The duty of care is clearly shared. Professionals need to be brave enough to speak out, and employers need to be wise enough to listen. But maybe it's even broader than that. As patients, as citizens, what's our role in all this? What's our part to play in demanding and supporting a culture where the safety of every single person is the one principle that can never, ever be compromised?